Okay, I know there are more people coming in, but let's get started because we actually have a lot to cover today. Um, Good evening. Thank you for being here and joining us for this incredibly important conversation about the impact cancer can have on our body image. As always, this program will be recorded. No faces or names will show on the recording other than those of the presenters. But if you wish to turn your video off for privacy now, the option to do that is on the bottom left of your screen. You can also choose to rename yourself if you prefer to remain anonymous. You can do that by clicking on the three dots on the top right-hand corner of your photo square. Directions to call into this webinar are in the chat box now. We also have closed captioning available, and instructions on how to access them are in the chat box right now. We received a lot of questions during the registration process, but you're still able to ask questions. Any ones that arise for you, please place them in the chat box at any time during this webinar, and we'll do our best to have them answered during the Q&A session. To send a comment or a question anonymously in the chat box, please click on the button that says Everyone, and then as you scroll down, you'll select Sharsheret, and your message will only be visible to Sharsheret, and we will get it and be able to ask it during the Q&A. I also want to remind you that tonight's program is scheduled to last 75 minutes rather than our traditional hour-long webinar. Finally, before we dive in, I want to thank our sponsors for today's program, Daiichi Sankyo, Merck, and Paxman. And as a program sponsor, Paxman now has a message to share with you. So, give me a second to, there we go. Scalp cooling, also known as cold capping, is the only effective way to help reduce and manage chemotherapy hair loss. This treatment is an important side effect management option, just like anti-sickness drugs, managing neuropathy, and immune suppression. If your healthcare team has recommended chemotherapy, but you haven't started it yet, now is the time to consider scalp cooling. ColdCap.com has comprehensive information on supporting you through the whole scalp cooling process and many resources to help you to decide whether the treatment is right for you. Scalp cooling should start at the first chemotherapy infusion session. There is no evidence to show that scalp cooling is more or less effective for different genders, ethnicities, or people with different hair types. Scalp cooling has until recently been an out-of-pocket expense. However, things are changing, and some healthcare providers are now able to bill a patient's insurance company directly. Ask your healthcare team if this is a possibility at your treatment facility. Thank you again to Paxman and our other sponsors of tonight's webinar. Let's dive in now. It is difficult to underestimate the impact a cancer diagnosis has and treatment have on a person's body image and self-esteem. Tonight, we're going to have this difficult conversation, and we have two fantastic professionals and two Sharsheret callers to help us do that. Joining us first is Dr. Michelle Fingaret. Dr. Fingaret is a licensed psychologist with 20 years of experience specializing specifically in body imaging cancer. She obtained her PhD in clinical psychology at Texas A&M University in 2004 and completed her postdoctoral training at MD Anderson Cancer Center. Dr. Fingaret was a faculty member at MD Anderson for 10 years, where she developed the only program of its kind in the U.S. focused on addressing body image issues for cancer survivors through combination of research, patient care services, and educational activities. She's published over 50 peer-reviewed articles, has been awarded numerous grants from the National Cancer Institute and the American Cancer Society, and has created the first and only academic textbook on body image care for cancer patients. She is a fellow and former president of the American Psychosocial Oncology Society. Dr. Fingeret founded Fingeret Psychology Services in 2017 to further her work in body image education and support for oncology healthcare professionals and for cancer survivors. We are really fortunate to have her with us tonight, so we are going to welcome her to the screen.
Hi, everyone. Thanks so much for having me. I'm going to dive right in because I think everybody on this call that's going to be talking tonight has some really important information they want to share. So hopefully, as I pull this up, everybody can see this. Yes, we're good?
Yes.
Okay.
Perfect.
Wonderful. So I'm going to dive right in. And the first thing I really want to do is be able to frame our discussion tonight. I feel like that's a really important place to start. So when we say body image, what does that mean? I really think about it as the personal relationship that you have with your body. It's very private and personal, and we're going to talk a little bit more about why that aspect of it is so important. But body image has a lot of different components to it. And I would say a very broad-based way of understanding it is all the ways that you perceive, think, and feel about all aspects of your body. So we know with cancer and its treatment that it affects your body in many different ways. And it's more than just about physical appearance. Body image is not just what you see when you look in the mirror or how you feel about the way you look. When we think about body image, we really want to take into account all the ways that we feel about the way our body functions or the sensory aspects of our body. And you'll see in a minute why this makes adjusting to the body image changes from cancer and its treatment so complex. And of course, at the heart of all of this is understanding that body image is completely subjective. It is only about how you experience your own body. And what we know is that there can often be a disconnect between how an individual experiences their own body and how loved ones perceive the person's body, or even how you perceive or think others perceive you. It's very complicated, but there can also be difficulties then in having these conversations. Healthcare professionals don't often see patients the way they see themselves in terms of their own body image. And so we have to just be attuned to the fact that what matters the most is your own perspective. Your perspective on your own body is the most important thing here. So I put this slide up just to give you a sense of the broad range of types of body image concerns that I deal with when I'm working with cancer survivors and their families. We're going to talk today mostly about coping with scars and with hair loss. But as you can see here, there's a range of other types of body image concerns that are very common for patients undergoing cancer treatment. I point to the sensory changes or changes in physical strength and stamina. Those are also really important. And when they're all happening at once, you're not just having one change. There's all of these changes happening at once in different domains. It's understandable why that can be overwhelming. So because I don't have a lot of time tonight to go through my information in depth, I tried to put this together as like my Body Image 101 for cancer survivors. And there's really three main points I wanted to bring to the forefront. First is really understanding that you're not alone, that all cancer survivors, does not matter what type of cancer you have to undergo some sort of a process of body image adaptation. Something in your body changes, you need to figure out a way to adjust to that. The individual adjustment process is extremely different for each person. And part of it is the body image that you come into this process with. But at the heart of the matter is understanding that the majority of patients who undergo cancer treatment will have concerns about changes to their physical appearance and their body functioning at some point during their treatment. That's a very normal and expected thing to occur. What I find way too often as a psychologist, though, is that there's a lot of shame and embarrassment and guilt associated with having body image concerns. And a lot of my patients don't feel comfortable talking and sharing that with their healthcare providers or with their loved ones because they feel like it makes them seem vain or superficial, that they should just be grateful that they're surviving cancer. And I really need to emphasize to you all how important and meaningful body image is, that this is really, really something I want you to stop for a minute and think about, what aspects of your body are the most meaningful to you? And have any of those been affected by cancer and its treatment? And if so, in what way? I sit with my patients often and get them to talk about meaningful experiences where they've felt connected to their bodies in their past, and trying to understand how that might be altered now. And that really helps us kind of frame why this is so important and profound. Another piece I want to highlight is that body image concerns can arise at any time during cancer treatment. There may be a number of you who have come into the process already having anticipatory anxiety over what body image changes will occur. But for some people, those body image concerns don't really come to the forefront of their mind, maybe until after the changes have occurred, especially if those changes were unexpected or something that they didn't foresee, if they didn't feel prepared for them. And then, of course, there are other people who might not have these concerns until later on, after treatment is done, when they think, oh, I'm done. I'm done with my treatment. I should now be getting back to more sense of normalcy in how I feel about my bodies. Why am I not feeling better about this yet? And that's when those concerns arise. So it's really different for everybody, but just know that these are all kind of core concepts, core fundamental concepts. And you might want to take a minute to think about this body image continuum and ask yourself, where am I on this continuum? I would not expect anybody on this call to say that they don't have concerns about changes to their body because, clearly in the title, this is what we're here to talk about, is how to address these things. But what I would remind you all is that it does not matter where you are on this continuum, from the standpoint that having the concerns themselves about the body changes are normal and to be expected. Now, they could be affecting you in a more extreme manner than someone else on the continuum, but the fact that you have the concerns at all is okay and to be expected. When I'm trying to get you to think about where you fall in this continuum, understanding that if you have more extreme body image concerns, it just means they're impacting your daily life more. Maybe you're having difficulties going out in public, or difficulties in your relationships with others because you're very preoccupied and upset by the changes to your body, and you feel so uncomfortable in your body that it's a constant thing for you, and it's happening, taking up a lot of time and effort in your day to manage those concerns and difficulties. But a lot of people, most people are going to be in the middle here, this average or normal concerns. It's normal to feel self-conscious about the body changes. It's normal to feel upset about them. Maybe you're thinking about these things come to mind in various times during the day, but generally speaking, maybe you have more realistic expectations for your body image, and maybe it's not impacting you in a severe way, but it's still affecting your life to a certain degree. It does not matter whether your concerns are mild, moderate, or extreme, from the standpoint that you deserve to get some support and help for those concerns, regardless of what level they are at. There's a lot of things that we can do to try to help with that. And I'm going to talk about that in a minute. I would also kind of caution those of you who might at times fall into this category of minimizing your body image concerns, not wanting to acknowledge or discuss them, or not feeling like you should be getting help for them. Hopefully by coming onto this call, you recognize the value and importance of getting support from different professionals and from peers as well. So let's get into some tips, because I'm hoping you're going to leave today with some information that's going to help you feel a little bit more empowered of what to do, depending on the way that these concerns may be affecting you. I do want to encourage you to be able to talk to your healthcare team about your body image concerns. Don't wait for them to bring it up. Be proactive in being able to assert that these are some issues that are affecting your life. One way to do that is to perhaps explain the importance or meaning of the body part that's been affected. Obviously, I know Gina's going to talk a lot more about hair and hair loss, and why hair is obviously such a meaningful and important part of somebody's identity. Breasts obviously have a very important meaning and function in our lives, and other body parts that may be affected by cancer. Discuss the concerns that you have about current body changes and worries that you have about future changes to the body, especially if any of those concerns about recent changes were things you didn't feel prepared for. And I would say the opportunity to talk about what worries you have for the future gives your healthcare professionals an opportunity to provide information and education, potentially some reassurance and some hope, and all of this is important. You could consider explaining the way that body image issues are affecting your life, if it's affecting you emotionally, if it's affecting you in social settings, at work, in your relationships. And don't be afraid to ask for help, therapy, or resources that they can provide. This is another area where I'd love to give you some things to think about. Being able to talk with some people in your life to get support is important. And it's important to have that outlet just to be listened and heard and understood. And a big part of this is finding the right type of people that you can talk to who can be a good listener and offer empathic responses to you. A big part of this is maybe redirecting people who want to fix or solve your problems. People can't solve your body image concerns. A lot of that is your interpretation of the body changes that have happened. And so this is not something that needs to be fixed per se, but it is an area where you could use support. And so I think when you have well-meaning friends and family who want to offer you all kinds of advice, sometimes it's a matter of just saying, I don't need your advice, I just need you to listen, or I need a hug, or I'd like to sit with you for a minute while I'm feeling sad. And be able to tell people and I don't even want to say take them off the hook of having to provide advice, but even explain to them that that's not exactly what's useful in this moment. And I would say there's a lot of well-meaning comments. I hear a lot of these things. People like to often tell you maybe how great you look, or how fabulous you're doing, or all these things where they're trying to be very positive and well-meaning. I mean, even maybe talk to you about, for a breast cancer survivor, don't you love your new boobs, and isn't that great? These are some of these, at the heart of this is well-meaning comments, but they can be very hard to deal with, especially when it's just constantly coming at you. So here's a few things I can give you in terms of advice. First, if it's the right relationship with the right person, is to be able to educate them that these comments about appearance right now are not helpful for you. I had some patients who used to tell me that they would say to their friends and family, it would be better for you to come and tell me, I'm so happy to see you, I'm so glad we get to spend time together, and redirect. Talking about my appearances, making comments about appearance are not helpful for me right now. And that really gives you a little bit of a sense of control over the interaction. And it also educates people that those types of comments are not helpful. They might not know. Oftentimes they don't. So part of that is as educating and maybe even redirecting people in a different way. There can also be an internal mantra that you might be able to develop for yourself. Saying things like to yourself, right? I'm a work in progress. It's really hard to hear these things. And I know other breast cancer survivors go through this as well. I'm not alone in this. There might be some ways that you can develop a little bit of an internal process that helps you kind of get through that. And then, of course, if you get to the point where you can accept the compliment, remember how I talked in the beginning about there being a disconnect between your own views of your body and your appearance, as well as how other people perceive you. They genuinely perceive you as looking good in their eyes, even if you don't feel that way, is to be able to just say, okay, thanks, and then move on. Sometimes getting to that point where you can maybe accept that compliment can be helpful, but educating, redirecting, accepting the compliment, or having an internal mantra can all be helpful in those situations. I need to go over this part. This is kind of the last piece of information I'm going to give in my portion tonight, but I want you to know that there's going to be a tip sheet for a lot of these things I've talked about. I'm going to give you as a resource guide that you can have and look through. This part of what I have done is develop this resource guide really for women who are about to undergo a mastectomy, and for tips for them looking at themselves in the mirror for the first time after surgery. But you can use these types of tips for any type of appearance change that you've gone through that you may be having some difficulty viewing the affected body part, okay? So a big part of this first is really being able to acknowledge the emotional impact that this is having on you in these moments when you're looking at yourself in the mirror or you're viewing the affected body part. Take some time to really check in with yourself and label the emotion. Is it sadness? Is it anger? Is it embarrassment? Is it disgust? Is it more than one. But being able to kind of check in with yourself is an important first step. And if you're having trouble looking at yourself in the mirror and you're delaying doing this, especially for the first time, the longer you wait, the harder it can be. So we really do encourage people to stop avoiding viewing themselves, because first of all, after a surgery, as just an example, there's so much healing that goes on right away that you actually miss the opportunity to appreciate how much better things get in the early stages of recovery. It's also important, excuse me, to think through, if you're having trouble looking at yourself in the mirror, maybe you take a picture or have somebody take a picture and you look at the picture. It gives you a little bit more distance, objective distance from that. Sometimes I tell people, don't look at yourself with all the lights on in the harsh hospital light setting or in the clinic exam room where the lights are very harsh. Turn the lights off to look at yourself for the first time, or dim the lights, and then gradually you can turn the lights up to see more. I often talk to people about using mirrors to look at themselves, and not starting off with a full length mirror or a magnifying mirror, but taking a small compact mirror that you might be able to look at a portion of the affected body part. You don't have to look at everything all at once. You can do it gradually. That's another strategy that we talk with people about. So there's more things on here, and what I'm going to do is just show you, this is my guide to all of the different suggestions that you can take with you. Some of this is also really being compassionate with yourself, being aware of what you're saying to yourself, that kind of all that internal dialogue. There's a lot of harsh and critical things that people say to themselves internally about their own bodies. And I do a lot of work with people on how to recognize that and be more kind and more gentle and more compassionate with themselves. So what I'm going to do here, since my time unfortunately is coming to an end of this portion of the talk, is just give you some resources. That's my website. There's a lot of resources for patients on that website about body image. I also post educational information on Facebook and Instagram. So you have all that. Please don't hesitate to contact me. I'd love to be able to provide any other information that I can. Thanks.
Thank you so much for that. Thank you so much for that. I found myself nodding throughout the entire thing. Everything just really resonated, and great information. Thank you. Next, we have two Sharsheret callers who are going to share their stories with us. Shelby will be talking about the impact that tattooing had on her. And after her, Shauna will be sharing her experience with scalp cooling as a way to manage anticipated hair loss from chemotherapy. So we're going to have Shelby join us right now.
Hi, I'm not sure if can everyone see me? I'm not sure if
we can
okay.
see you. Spotlight. Yeah,
Great.
you're there. Okay, we can see you.
Okay. Hi, my name is Shelby. I was diagnosed with breast cancer when I was 29 years old. I was recently engaged, really starting a new journey, living my really was just like living my best life. I have a strong family history of breast cancer, but I thought I knew I was high risk, but that felt very, very far in the future. I was diagnosed with hormonal positive, HER2 negative breast cancer. And because of my family history, I chose to be a bit more aggressive and had a double mastectomy. And because of the location of my tumor, they were unable to save the nipple. So then in fall of 2022, I had went through chemotherapy, and even though I tried to preserve my hair with cold capping or scalp cooling, I still ended up losing not all of it, but a lot of it. My eyebrows and eyelashes did their very best, and I lost them right at the end, which my understanding is pretty typical. But I had a moment in December that I'll never forget, where I started chemo end of September, finished in December, where I was looked in the bathroom mirror just in my apartment and I literally didn't recognize myself at all. And it was like jarring for me. My face was very swollen from the steroids, you know, the no eyebrows, the very little eyelashes. It all just really compounded at that point. And it like took my breath away. I was very shaken up by it. So through Sharsheret, I was able to get eyebrow tattooing, which is like the first step in really starting to feel like myself. My like drawn on, trying to fill in my eyebrows was just like not the same as I looked. And I felt very self-conscious about even like seeing friends. Because I just felt so self-conscious about how I looked, and all I wanted was to feel like myself again. And the eyebrow tattooing really gave me that. It was the first step in what was a longer process, in feeling like me again. And I also felt very comfortable doing it because I was also very nervous after all the things I went through about going somewhere that was going to do a good job and was reputable and clean. And I knew because Sharsheret I felt like they vetted all of these providers, that I knew that I was going to have a really good experience. And that made me feel really, really comfortable doing so. And then because I was getting married, I had a wedding already planned before I was diagnosed for about a year after I was diagnosed. I really the whole time felt, you know, worried about this upcoming event, but also I really wanted things to feel as like buttoned up as I could have them feel before I started the new chapter with my now husband. So I really wanted to get like the surgery had to have I had to have a follow-up surgery, like a second phase of it, they call it. But I was really eager to get the nipple tattoos or the micropigmentation, because to me that felt like the final step. And up until that point, things sort of felt like they just needed to be checked off the list. Like, okay, I had to do the IVF, then I did the chemo, and I was going through the steps. And the micropigmentation really was that last step I had on that list. And so I was eager to get it done as soon as my surgeon gave me the okay. But once I got it, I didn't realize how whole I felt by getting it done. That I didn't realize that I felt like a piece was missing, because I think I kind of was just on autopilot, like I said, just trying to check things off, go through the process. So I was very, very grateful. I still am very grateful that I was able to get that through Sharsheret, because even though it seems so necessary, my insurance was a little dodgy and finicky about it. And I wasn't sure if I was going to be able to get it covered. And it's just amazing. The job was phenomenal. It's literally 3D art. You would have no idea that it was a tattoo unless you were like physically touching it. So I'm just very grateful that I've had these experiences that really helped propel me in moving forward. I'm still, you know, on hormonal therapy and, you know, monitoring, but those were really big moments for me in moving on to my survivorship.
Shelby, thank you so much. I bet that your story resonated with a lot of people, and it was very meaningful that you shared it. So thank you.
Yeah.
Next, we're going to bring on Shauna. Shauna has a story to tell about scalp cooling and how that impacted her. You're muted still.
Here we go.
Here you go.
I am so happy to be here and speak with other people, because I find myself nodding to practically everyone that's talking tonight, because it reminds me of what I went through. And my treatment for breast cancer, HER2 positive, was back in 2014. I had just retired from teaching, woohoo! And I was going to have a fun job. And the following week, I found out that I had breast cancer. I was fortunate. I feel truly that God was leading me in a new path, not one I wanted to take, but I just kind of felt like this is totally new territory for me. So I'm going to ride this magic carpet and see where I go. I was able to be in a trial for scalp cooling, and I kept about 70% of my hair. And I think probably one of the most important things I recognize out of that is that I got to make that decision. I got to decide whether or not I wanted to do that. And to me, it was very powerful because right in front of me, my oncologist is writing all of these things down, what my treatment is, what my meds are. I can't even pronounce them. And I felt like I could take one little slice and make a decision on that. And I'm so fortunate that I did it. I consider myself a happy camper because a couple things that I recognized during this, and one is take care of yourself. And I see now some of the things that I enjoy, I like to surround myself. And I remember during my treatment, I told my husband, I am going to do something nice for me because I'm going to kick cancer's Watusi. And that means I need a new pair of shoes. And so after every treatment, I would go to the store and buy another pair of shoes because we all need them, don't we? So anyway, I like to cut flowers in my garden. I like to do things that make me feel good. Some people may feel like scalp cooling, we're going to have icicles hanging from our nose, and it's just not that way. I didn't feel that way. Matter of fact, it's the opposite. I would actually, Girl Scouts honor, I would call this my spa day. Because if I had a treatment on Tuesday and I had 6 treatments, there was a lady that would come by and massage your little feet for about 3 or 4 minutes. And you're sitting there and you have a nice warm blanket. And being a teacher, and so many of you have jobs where you don't have time to think and you're eating at your desk if you're eating lunch. And I remember thinking, oh, I can watch everybody. It's like an orchestra, but I don't have to do anything but just watch. And that was so nice for me. So even though it's a long treatment, I appreciated the opportunity that I got to be a part of that FDA trial. So that really makes my heart happy. When I first put the cap on, and it has these channels, if you will, and then another cap goes over it to hold in the cold. And when they first turned it on, I thought, what is this going to be? And I could hear the water go through the channels. And it reminded me, it took me back to my junior high days of being in swim team. When you're on that block, and you know that whistle's going to blow and it's going to be cold, but it's exhilarating. And when you go in the water, that sound was the same thing I heard, and I loved it. And it was fun. After the first 10 to 15 minutes, it really kind of goes away. For me, I wish I had one of those things at home so I could do it every day because it's very calming and comforting. So everybody is different. But I really appreciate that now I can look back on that and recognize that there were a lot of wonderful, good things besides 6 new pair of shoes.
Thank you so much, Shauna. I really, what resonated with me was this was a choice you were able to make. You're writing in the cancer experience. So many of our choices are taken away from us. So to have this choice is very meaningful. Thank you. I wanna thank both Shelby and Shauna for sharing their stories with us tonight. When we hear from those who have been through it themselves, we understand what's being presented to us in a completely different way. And so that is really meaningful. Thank you for your generosity. Next, we have with us Gina Doyle Rule. Gina is a licensed cosmetologist with specialized training as a medical aesthetic provider, corrective makeup artist, and oncology esthetician with over 30 years of experience in the beauty and aesthetic industry. She wrote and published the first beauty book on wig selection, Wig Ed, and developed an internationally approved training curriculum on oncology makeup and wig selection called the HOPE method. HOPE stands for Helping Oncology Patients Aesthetically. Gina writes articles and delivers talks and workshops for medical and beauty industry giants. And just this year, she founded Rule Beauty, where she provides makeup services for adults affected by appearance-altering illness or injury, and education and training for medical and clinical practitioners in medical makeup techniques. We are so excited to have her here with us. Gina, welcome to the screen.
Thank you so much for that. It's really an honor to be here. As the song goes, we have a long way to go and a short time to get there. So I'm going to get right into it, and we're going to do what they say can't be done. I'm going to share my screen with you. I'm covering two subjects tonight. The first one will be
Perfect.
Right. The first one is on scars and cosmetics and how to use those. So let's get into that. So with scars, there's a couple categories. You could receive a scar from an accident or an injury, or a planned scar like a surgical procedure. So we're going to be talking about planned scars, and mostly scars that as they impact our face, and not scars that are covered by our clothing, just for sake of time. However, one of the handouts has a more lengthy informational outlay of how to vet people that work on scars and different things that you might find very interesting. I just don't have time to go into that. So let's get started on scars. And the first thing I want you to know about treating scars with makeup is, one, safety first. You have to be cleared to work on the scar first. So we want to make sure that you're about 2 weeks out, there's no open sores, oozing, anything like that. And then I like to also get approval from the treating doctor that he says, hey, it's okay to use cosmetics. Now, up until that point, you still want to be vigilant about sun protection. And if you're not cleared for cosmetics, you want to be sure that you're using a hat or a visor to protect the affected area, because you'll be much more reactive. And sunscreen is really a long game. So we really want that protection. So if you're not cleared for wearing cosmetics or sunscreens, you want a physical barrier. I like to keep one in the car, unless you travel by tunnel. When you're in your car, you're getting sun as well. So you want to be mindful of, if you have your morning tea or coffee sitting by the window, you're susceptible to getting sun damage. And you're more reactive at this time when you're going through treatment. So pay super vigilance with that. Once you're cleared by your doctor to wear cosmetics, you can wear sunscreen, but you really need to double down on it and still have the physical protection of some type of hat or a visor when you're out and about. And I just find if I throw one in the car, then it's there when I need it. So broad spectrum SPF 35 is good to kind of help with that. Now for the actual scar itself, once it's healed, we're cleared for wearing makeup. We have kind of two categories with the scar. We can have one that loses pigment, it has no pigmentation, or one that's more vascular, where there's more pronounced pigmentation. And the sample of the girl that you're seeing here right now, she has a scar through her eyebrow. She has a scar from something other than cancer. But you can see with a very light eyebrows and loss of pigment from the scar, recreating the illusion of eyebrows was super helpful for her. And that's one of the tips, is sometimes you want to look at the face as a whole and not just the scar, and kind of treat the whole face, so that bringing attention to her eyebrows kind of brings attention away from her skin. One of the techniques with a scar that is lighter in appearance is to put a little bit darker product on the area that's light, and then a lighter product on top of it to blend around. And the reason for this is because that pigmented area, if you use a color that is your skin tone and the scar is lighter, it's not enough to bring it up to the level that you need for coverage. So even in that area, if you were just drawing a little bit of product that was a little bit darker in the area where there's a loss of pigment, and then putting pigment on top of it, you will have a better outcome with that. Now, this next slide is another great example of using kind of the tools we have at hand, using the whole face to kind of bring more balance and symmetry to the face. And with this scar, the scar itself is a little bit vascular. It's darker if you look at the other side of under her eye, it's a little bit darker. And we don't want to go lighter with that. So light doesn't cover dark. Just as we wouldn't take a white top and put it over a black bra, a light makeup doesn't work well on top of darker skin. What you want to do is match the existing skin first, and then put a lighter product on top of it. So you can layer a darker makeup with lighter makeup, but if you put lighter makeup on top of dark skin, it's going to appear flat. Just as in case with the reverse with the lighter scar. So you have to first kind of bring it up or bring it down a little bit, and then put makeup on top of that, if that makes sense. And then you have the whole face to work with. So you can work with the lips, you can work with the cheeks, you can work with the brows. The nice thing about having eyes as a balancing point when you work with the brows is that there's two of them, so it brings a lot of symmetry to the face. So that's a super helpful area to consider when you're addressing scars that are on the face. Now, for this one, in the case of a skin graft, you want to be using a product that is opaque enough to cover the area, but I leave the rest of the face translucent. So you don't have to have a full face of heavy opaque makeup. Just use a more densely pigmented product in the areas where you need to. And then again, this is an example of where the brow can really, even the illusion of a brow can really help to bring symmetry to the face. So the area on her cheek just below her eye that doesn't have a lot of pigment there, it's really hard to recognize it in the after picture. And that's just using something that will kind of help darken that area and then smoothing that out. Now, with texture on the face, you want to try to remove all of the vellus facial hair. So that fine little facial hair that we have in a scar, you won't have hair, you won't have pores. It's not the same skin. So if you can remove all of the facial hair, you're going to have a better time blending to the other areas. Now, in the case of a graft, you may have a graft from another area of the body and there may be hair produced there. But then you can address that as well. But removing any fine vellus facial hair will not only help the makeup to blend better, but it will help with any textural differences that our eyes can pick up. So keeping a smooth difference there is really key for addressing the scars. One other thing that I wanted to mention about scars on your body, and that is with the sun protection, if your garment you can hold up to the light and you can see light through it, then the sun can get through it. So we want to protect those areas too. We may not be addressing those with makeup per se, but we do want to protect those with sun care. So that's pretty much my tips for the the scars. You'll have two handouts that you'll get from this presentation. One is really all the bullet points that I just went over a little bit more succinctly for you to just kind of go back and review. And then the other one really talks more about the anatomy of the scar, different types of scars, how to find someone that can help you, navigate and treat your scars. So those are really helpful resources. And the next subject is going to be the hair loss before, during, and after treatment. So before treatment begins, or before hair loss begins, when you are aware that you're going to be having a treatment that will cost you hair shed, you want to consider getting a turban. And the turban is very helpful for coolness that you might feel with temperature fluctuations, because as we're losing our hair during the night, because it holds in a lot of heat, it can make us cooler. But also the shedding process can be something that's really stressful for a lot of people. If you contain your hair in a turban at night when you sleep, then when you wake up, it will be in the turban and not all over your pillow. In that same vein, you want to consider wearing clothes that are slicker. A cotton, the hair is going to stick to. So for that shedding phase, you're going to find that cotton's going to be more challenging. A polyester or a silk or a smoother fabric, the hair will kind of slick from. The other thing I like to tell people about the shedding phase is that you can't control whether or not your hair will shed, but you can control when you're most likely to deal with that. And what I mean by that is, if you typically shower in the morning and you move that routine to a nighttime shower, you will find that you won't have as much management of the hair loss first thing in the morning when you're trying to get ready and get out the door. So a nighttime routine may be really helpful in helping you manage when the shed happens. So use a turban for that period, for day and night. Be mindful about temperature regulations at night. So you want something on there. The other thing is sometimes there's some tenderness associated with it, and that turban can really kind of help with the coziness. Now for the tenderness, I'm going to go to the next slide. For the tenderness, some people will reduce the length of their hair before they're ready to shave their head, and that's perfectly okay. I tell people, hey, you can take this in steps and make adjustments along the way. What I want you to know about wigs is that they've come a long way, baby. So this wig here is a synthetic wig, which is something I highly recommend when you're going through treatment for what we consider short-term hair loss. Now, if somebody were wearing a wig long-term, like they had alopecia, we would recommend maybe a human hair wig, but not as your first wig. For your first wig, I always recommend synthetic, and you can see really just how believable this wig is. So shortening your hair before, shopping for a wig before you need one is great, because you really have the opportunity to take a dry run, go to a coffee house you don't usually go to and try out that wig. So if you decide that you want to shave your head, here's the important points about that. We always see the beautifully pancaked head with perfect makeup and no hair when we're dealing with oncology stuff. But what I want you to do is leave 1/4 of an inch. And that is because there's a risk of infection. But also, if you are going to wear a wig or a hat, you're likely to get ingrown hairs if you shave it to the scalp. Now, will that remaining 1/4 of an inch still shed? Yes, that's what your turban's for. It will help you with the collection of that. So finally, here are some regrowth strategies. If you'll see, there's a picture of her, the hair comes back, and one of these things is not like the other. It's not what you remember. The color's different. There's some different things going on with the hair. All we did for the after picture was trim it and put a little product in it to give it a more intentional look. Most people, when they have enough coverage of their own hair to go without a wig, they are sans wig. But keeping it short while it's growing out, putting a little bit of product in it can give you a really an intentional look. And I can tell you, this woman, his hair is down to here now, but she still says that's her favorite haircut ever. So those are just some tips to help you navigate the different phases of hair loss. I do have a really a comprehensive guide that I think is 4 or 5 pages that walks you through everything you need to know when you are trying to even figure out where to get started with wigs. It tells you kind of what to consider when you're shopping. And then the other handout is one that really just bullet points all of the things that I just spoke about in this session. Thank you for your time. I really have enjoyed sharing with you guys, and I look forward to a robust Q&A session.
Thank you so much. If you could unshare, I'm going to bring you and Dr. Fingerette back up on the screen for some Q&A. Thank you. That was great. And we have a lot of questions. And if you have questions you haven't shared in the chat box yet, please share them. So let me just start off with something that is actually a question that came in, but not specifically for either one of you. So somebody asked about scalp cooling and if it was painful. And I think that our caller, Shauna, did say everybody is different, and some people responded in there. But I just want to say that one of the services that Charshare provides is peer support, where you can learn about other people's experience and they can help you make decisions. So if you're interested in having a peer supporter who did scalp cooling and you want to hear about their experience, you can absolutely reach out to us at clinicalstaff@charshare.org. But let's get into, which is in the chat box right now. Let's get into some of the questions. So actually one that just came in was scalp care when you have no hair. Obviously sunscreen, I mean, you were very clear about that, and that's a good one, but scalp care to keep the skin healthy and soft, and maybe even some scalp care that might encourage regrowth. Anything you can talk about with regard to that?
Yes, for the scalp care, this is a time where most of us don't get to see our scalp. It's a time to really treat the scalp. You do want to wear the sunscreen. I like oils for at night underneath the turban. I don't use oils during the day because of the risk of burning. So during the day, you can use your moisturizer, wear a hat. If you can see through the wig, you'll want to wear sunscreen with that. Practice to help encourage growth is dry brushing. There's a lot of great articles on that. Think of a boar bristle brush that's like a baby brush, and you're just brushing the scalp before you get into the shower. And I always tell people, if you have little ones, if you incorporate that practice, you read them a story and they brush your scalp, you're more than likely to do it.
That's sweet. Okay, thank you for that. Somebody, actually more than somebody, a few people, Michelle, this one's for you. A few people talked about feeling disassociated from their body, like even a couple of years later. So I guess when this is like a long-term issue, what do you suggest in terms of like your body is still yours, even when it looks and feels different?
Yeah. Well, that's the whole concept of like reconnecting to your body. And what I would really say kind of on a very basic level is you have 5 senses. Let's use all 5 of them. And let's think about different ways that you can reconnect with your body. We talk a lot about appearance enhancing activities that you can engage. And I think we've kind of had that covered from both of our callers as well as Gina, where there's lots of ways that you can do things to try to enhance your appearance. But let's talk more about sensory connections. That could be wearing clothing that feels good on your skin. It could be also using your sense of sight to look at beautiful things in nature. Connecting with your body in that way is just trying to think through anything that you can touch and feel against your skin that makes your body feel good. Tastes, sounds, soothing sounds. So, I go through a lot of activities with my patients where we really get them to plan out these different types of activities that they can feel more connected to their bodies. And I think part of it is really playing the long game and knowing that maybe there's something you can do each day to help you feel more connected, and it builds on each other over time. But it's not a matter of, I'm going to give you a prescription and you do these 3 things and all of a sudden you're going to feel totally connected to your body, right? So I would think through, though, all the different ways that you can use your senses to feel more connected to not only internally with your body, but your body in space in the universe, if that makes sense.
Oh, I like that. I like that image. Thank you for that. A lot of follow-up questions, Gina, on what you were just talking about. So first of all, there's a question about more long-term or permanent hair loss. Some people were saying that the drugs like tamoxifen or aromatase inhibitors are still causing hair to fall out and not grow back as robustly. Somebody asked, is there such a thing as like permanent alopecia from cancer treatment? Is that a possibility?
That is something that I recommend they would talk to their doctor about, just to give them clearance on that. Some people, even with the Colcap story where she lost 70% of her hair, that 30% can be addressed with a partial wig. So it may be that you don't need a full wig. You could use a topper or, something to kind of help with that. It's hard to judge the hair while you're still on maintenance therapies because it does impact the hair. But sometimes through styling and strategic use of partial wigs, there are solutions you can come up with that feel more like you, that can work for, your privacy and your sense of identity, which are all so important with this.
Thank you for that. Somebody also, a quick answer. If somebody has alopecia, will dry brushing also help hair regrowth for that?
If their hair loss is due to alopecia, not medical alopecia like you had to have the chemotherapy, but if they have like universalis or something like that, the dry brushing is not likely to help, but it would be a good practice for the skin.
Okay, perfect. Thank you for that. Dr. Fingerette, can you talk for a second? And I'm guessing there might be a little nuance here, but a lot of the stuff is the same. As opposed to reconstruction, those of us who have chosen to not reconstruct or to go flat, is there something you can share with us? That's a very big decision in a society where breasts are a very important thing, both for individuals and for the world around us. So can you talk about how that decision might impact our body image and how specifically to get around that, or not around it, but deal with it?
I think probably a big part of it has to do with the reactions of others versus your own intentions of what's meaningful and important to you and how you make that decision. And so I think a big part of it is making sure that you are staying true to yourself, and sometimes being able to separate out how much of that discomfort has to do with the discomfort of those around you, or even if you're in a relationship where but it is your personal private relationship with your own body that is important. And look, I haven't talked a lot about the role of therapy, but both in the last question that you asked me and in this question now, like, you can be very clear on what your decisions are around body image in that moment, right? And by the way, these decisions can be revisited at a later time, both if you get the reconstruction and then decide to have, for example, if you have an implant and decide to take the implant out, or if you decide to go flat and then later decide you want to try to go for a reconstruction. Nothing is permanent in this setting. But I think being able to have a space where you can explore what all this means for you and how you want to approach it, and then dealing with kind of the aftermath of it can be really helpful in a therapeutic relationship. So some of this is not, I can't just give like a quick answer on a webinar and say, okay, here's what you do.
Right.
So think about that. But again, a big part of this is really, I think, understanding your own personal viewpoints and recognizing that your body image is your domain. It's not other people's prerogative to have, input and say on that. They should be there
Empowering.
to support alongside you. But sometimes it's important for you to really check back in with yourself and gain some clarity that way.
That feels very empowering. Yes, I know that many of us have had reactions to the changes of our in our bodies from other people, and to remember that those might be hurtful, but they shouldn't impact our overall body image. That's an important piece. Thank you. Okay, a question for Gina about supplements. So again, we're focused on hair loss and hair regrowth, or more importantly, hair regrowth. Are there oral supplements we could take? Is there a particular type of shampoo that's better to use than not use? And then let's just kind of throw it all in there. Somebody asked about how very often when hair grows back, it's gray. Is there a safe dye to use both for that new baby hair, but also just in general as a cancer survivor?
Okay.
It's a lot of questions. I'm sorry
No,
to throw
that's
them all
okay. I'm
at
gonna
you.
try to remember them all. Supplementation is something that you should absolutely 100% talk to your doctor about. It's not something that I recommend. I know that they don't like you using follicle stimulating hormones like lash growth serums or hair, brow growth serums during treatment. So that is something you should talk to your team about. That said, as far as shampoos, most of them kind of tell you what they're doing, even if they're not trying to tell you what they're doing, which is, think of it as new hair. So you want one that is for curly hair, whether you have curly hair or not, because it's a higher moisture content, right? You want to avoid ones that say clarifying or deep cleansing because they have a lower moisture content, or for straight hair. So you want a more moisturizing, more gentle shampoo at this time. Now, as far as the color thing, sometimes the color corrects itself with time, but this is new hair. So just as a hairdresser, we don't like to color people's hair when they're less than 12 years old. Think of this as new or 12-year-old hair. We don't really want to color it right away. You do want clearance before you do that. That said, a lot of women will opt for ammonia-free. So you'd want to go to your hairdresser and say, hey, I'm trying to do as few chemicals as possible. Would an ammonia-free work? That's honestly how the gray trend got started, because a lot of women were growing their hair back and they were just like going with the gray. They didn't want to color right away. And then they were like, hey, I kind of like this. So it's a very personal choice. But I'd say stay away from ammonia on that. Ask your doctor about supplementation. And for shampoos, you want gentle, sulfate paraffin free, something that's moisturizing in content.
Thank you for that. Okay, some follow-up questions. I'm going to preface your answer with saying any kind of supplements you need to speak to your doctor about. Absolutely. Especially I'm seeing here not just supplements, but questions about other drugs like minoxidil. Those have to be discussed with your doctor. But somebody did ask if you have anything to say about biotin or saw palmetto. And you could say no.
Well, I don't like to comment on those things.
Okay, fine. That's fair.
The general practice.
That's absolutely fair.
But I will say, you do, taking a page from Michelle's book, you do want to be kind with yourself and give yourself time for your hair to come back. We kind of get impatient and we're ready, and I get it. But try to start practicing some self-love where you're at and give your hair time to kind of come back in. And some of these things won't be as necessary in a short amount of time. The hair regrows at about a half an inch per month. So at about 6 months, you have pretty much enough coverage that you'll need a haircut and can go without the wig, if that's
Okay,
helpful.
perfect. You know, we had another webinar recently on like style while you're going through this, and somebody who has a line of turbans, like you mentioned, came on, and one of the things she said, which I think might be relevant to hear with so many of these questions about hair loss, is just because you buy a wig doesn't mean you're not going to some days want to just put a turban on. And just because you are committed, you know, you've chosen scalp cooling doesn't mean you're not also going to want either a turban or a wig for some days. Like it's not a one or other thing, but you know, there are different days, and then some days, you know, when that cute hair you showed where you just put a little product in, some days you're going to be rocking that hair, and other days you're like, oh, I really want to wear my wig, or I want to do that. So, so that's important to keep in mind. Okay, 2 more questions, I think. One of them is for Dr. Fingerat, and it's about self-breast exam after lumpectomy or even mastectomy. So someone says that her doctor is insistent that she is diligent about these self-exams, and she really struggles because they don't look, they don't feel, they don't behave like her former breasts. And here is, she's struggling with that. And yet it's not just, it's even more, it's a body image issue, but it's also a health issue. And any suggestions for a way to frame that so that she can do something that is incredibly proactive and protective of her health?
Wow, that's actually not something I've talked with directly about patients in my office. So I think I'm gonna just offer kind of a thought process around first connecting with that part that is driven towards the behavior, right? You have this part of you that's driven towards the behavior for all of these important health reasons. And then clearly there is the part that maybe is very difficult. I don't know what it's like when you are either thinking about having to touch your breasts or look at your breasts, or, you know, all of that. There's kind of that push and pull. It sounds like a very distressing place to be. And so part of it is having to understand what that is all about and what your ultimate goals are and how you can get there. So I would say that sounds actually very complicated if it's preventing you from reaching the goal that you have, which is to take the steps you need necessary for your health. So I understand why that would be very confusing. I would kind of go back to this whole idea of being very compassionate with yourself as you struggle with this, that it makes perfect sense why you would struggle with that. But it's also about really trying to understand if there is a lot of avoidance of touching yourself or looking at yourself, and then how that's impacting these other things that you feel you need to do for yourself. So I think there's some work that needs to be done there for sure. I think it's a clear issue that needs to be addressed. I don't want to say solved, because I think that's too strong of a word, but bringing it up and recognizing the challenge and being really honest about how it's impacting you. It kind of goes back to that slide that I had on talking to your healthcare professionals and talking openly about your concerns and why this bothers you. Really being able to understand that kind of meaning and importance of how this is, you know, traumatizing in a way is what we're talking about. So I don't have a clear answer again that I can give in a, you know, summary at the end of a talk here, but I would say that's an important issue that needs to be addressed for certain. And be caring and compassionate with yourself and get the support that you need from someone you trust that can be sensitive to what that's like for you. Does that make sense what I'm saying?
Yeah.
Not discount it as, well, just get over it. That's not the right answer. And if that's what's happening, please find somebody else that can be supportive to you and kind of align with you on what this is like for you.
No easy answers to some very deep concerns and questions, but we get it, and you've pointed us in the right direction, and thank you for that. Okay, I have one other question for Gina, but something else just came in, and my colleague reminded me that she's asked this a lot. So let me add that one in. Somebody asked about hair extensions. If you have a little bit of hair growth and you want to speed things along, is it safe to get hair extensions? At what point can you get hair extensions? Is this new hair strong enough to manage hair extensions?
There are some hybrids. I have worked with people that had some hair loss with cold caps, and we worked with extensions. You want to make sure with the extensions that it is the kind that is glue and doesn't have the metal bonding, because you'll be having MRIs, you'll be having follow-up procedures. So you really want to make sure that whoever you go to can do that. Now, that said, extensions usually are below this portion. So if you don't have hair to attach it to, you could do some extensions back here and a topper on top to kind of work with the hair loss. So there are some things that you can do that may not be a straight line. And your hairdresser should be able to tell you, yes, this is strong enough for a few extensions. Maybe you won't get the thickness that you desire, but that with a topper could solve the problem. You just want to make sure you go to someone reputable and that they don't use the metal bonding.
I hadn't thought about the metal, but that's a really important point. Okay, the last question that I had actually planned to ask you was about reducing the look of scars on our torso, whether it's from a mastectomy or an oophorectomy. So is there a way to reduce the look, and is there a way to prevent or reduce the risk of a scar becoming a keloid scar, or like one of those raised red scars?
Well, sun protection for the vascularness, a keloid is going to happen. That depends on your body and how you react. So in that scar handout, there are things that can be done for keloid scars. As far as on the body, you can put cosmetics there. You just have to be careful of the rub factor, so that if you're on a white top and you're moving around, so there are things that you can do to protect that. They even make some protection that's kind of mineral based and it's pigmented. So there are things that you can do, but it's kind of clothing dependent on if you would see that, or not.
Right. And you're saying really with the keloid scars, it's more about how our bodies react. So there's nothing to be done to, okay.
Nothing preventative. You're going to keloid or you're prone to that or not. So, and not every, buddy gets a keloid every time that's prone to that, but.
Okay. All right. So you know what? We have just a couple of moments left, and I want to just start off by giving our many, many thanks to Dr. Fingarette, to Gina, for providing guidance and passion as we adjust to the changes in our bodies. And to Shauna and Shelby, we are so grateful you were willing to share your stories with us. Thank you again to Paxman, to Daiichi Sankyo, and to Merck for their generous support. Please take a moment to click the evaluation link that's in the chat box now or very shortly. There it is. It will just take a moment, and you'll be able to actually continue to listen to the webinar as you complete the evaluation. Before you go, I want to remind you that Charcheret is here for you. Our social workers are available to answer your questions, provide support, and connect you to resources. And you can reach our social workers through the email address in the chat box now. And Charcheret has programs to help with what we've been speaking about this evening. Our Best Face Forward Kit is a free box filled with paraben and phthalate-free cosmetics, lotions, brow guides, and more to help you manage the cosmetic side effects of treatment. Again, this is a free kit that you can order through our website, but when you fill out the evaluation, there's also a place to order it there. Charcheret also provides need-based financial subsidies for some non-medical expenses, again, related to the conversation tonight. We provide financial assistance towards scalp cooling, for the purchase and styling of a wig, for microblading, which is the eyebrow tattooing, and for nipple and areola tattooing. I do need to note that for the first time ever, the demand for these subsidies, which we call our BFF 2.0 program, has exceeded our capacity for the quarter, but I am happy to share that the program will reopen on July 1st. We're going to put that evaluation link in there one more time so that if you wanted to order your kit, you would be able to do that very quickly tonight. Thank you again for joining us and have a wonderful evening. Good night.